Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share and subscribe Dr. Ravichandra Official. In this video, we will discuss genetic disorders. What are developmental defects? A group of abnormalities during fetal life due to errors in morphogenesis are called as developmental defects. What is the pathogenesis? Certain chemicals, drugs, physical and biological agents are known to induce such birth defects, and these are called as teratogens. And the teratogens causing the effect is called as teratogenic effect. The teratogens may result in intrauterine death, intrauterine growth retardation, functional defects, and malformations. Classification of developmental defects. It can be agenesis, aplasia, hypoplasia, atresia, developmental dysplasia, dystrophic anomalies, ectopia, or heteropia. So, first, what is agenesis? Agenesis, that is complete absence of an organ. Example, unilateral or bilateral agenesis of kidney. Aplasia, absence of development of an organ with presence of a rudiment or analog. Example, aplasia of lung with rudimentary bronchus. Hypoplasia is incomplete development of an organ not reaching the normal adult size. Example, microglossia. Atresia. Atresia refers to incomplete formation of the lumen in hollow viscus. Example is esophageal atresia. Developmental dysplasia is developmental defects of the cells and tissues resulting in abnormal or primitive histogenic structures. Example is renal dysplasia. Now, what is dystrophic anomalies? Dystrophic anomalies are the defects resulting from the failure of the fusion. Example, spina bifida. What is ectopia or heterotopia? Ectopia or heterotopia refers to abnormal location of the tissue at ectopic site. Example, pancreatic heterotopia in the wall of the stomach. Examples of the developmental defects: anencephaly, spina bifida complex, thalidomide malformations resulting in phocomelia, fetal hydantoin syndrome, fetal alcohol syndrome, large complex of infections, and congenital syphilis. Genetic disorders are mainly classified into single gene disorders, multifactorial inheritance, and chromosomal disorders. Single gene disorders are further classified into Mendelian and non-Mendelian inheritance. Mendelian inheritance is further divided into autosomal disorders and sex chromosomal disorders. Autosomal disorders can be autosomal dominant disorders, autosomal recessive disorders. Sex chromosome disorders can be X chromosome linked or Y chromosome linked. In the X chromosome linked, it can be dominant or it can be recessive. Coming to the non-Mendelian inheritance, it includes genomic imprinting, mitochondrial inheritance, triple nucleotide repeat mutations, or trinucleotide repeat expansion disorders, and germline mosaicism. Mendelian type, as I said earlier, it can be autosomal or recessive, and autosomal dominant, autosomal recessive, and X-linked dominant, X-linked recessive, and Y-linked also. Autosomal dominant disorders, they can express themselves only in a heterozygous state, and it affects 50% of the progeny. One parent is affected in each generation, and such inheritance is called as vertical inheritance. So in the exam, they may ask you in the MCQs, autosomal dominant disorders show horizontal inheritance, vertical inheritance, both, none. Answer is vertical inheritance. And these autosomal dominant disorders will affect structural proteins mostly. Any genetic mutation will have two possibilities. One, it is underactive, or the other is overactive. Underactivity will lead to loss of the function mutations, whereas overactivity will lead to gain of the function mutations. Autosomal disorders, dominant disorders, majority has loss of function mutations and affect structural proteins. So keep remembering these 2 points. It will affect the 50% of the progeny, heterozygous state, vertical inheritance, and majority has loss of function mutations and affect structural proteins mostly. Examples for autosomal dominant disorders are von Willebrand disease or von Hippel-Lindau syndrome, familial hypercholesterolemia or familial adenomatous polyposis, polycystic kidney disease, osteogenesis imperfecta, Marfan syndrome, intermittent porphyria, neurofibromatosis, achondroplasia, multiple endocrine neoplasia, tuberous sclerosis, Huntington's disease. Overactive defective gene will cause gain of the functional mutation, thereby release of the toxic proteins from the Huntington's gene, thereby causing the damage to neurons in Huntington's disease. Hereditary spherocytosis is also one of the example for autosomal dominant disorder. Properties of this disorder. There may be incomplete penetrance or variable expressivity or pleiotrophy. Autosomal recessive disorders, they involve enzymatic proteins mostly as seen in case of inborn errors of metabolism, and it is expressed only in homozygous state. Has an early onset of clinical manifestations due to homozygous condition. There is complete penetrance, that is all persons who are affected will show the clinical manifestations. Common in consanguineous marriage, and the parents of the patients act as carriers and siblings are affected, and this type of inheritance is called as horizontal inheritance. So difference between a dominant and recessive disorders of autosomal is that is causing 50% of the progeny, here complete penetrance, and it is a heterozygous state, here homozygous state. There vertical inheritance is there, here horizontal inheritance is there. There structural proteins are involved, here enzymatic proteins are involved. Examples are Friedreich's ataxia, sickle cell anemia, thalassemias, Wilson's disease, hemochromatosis, hemocystinuria, alkaptonuria, and inborn errors of metabolism, that is glycogen disorders and lysosomal storage disorders, will come under autosomal recessive disorders. Sex-linked disorders can be X-linked or Y-linked. In the X-linked, it can be dominant and recessive. Father to son can't take place. In the Y-linked, in this only in males it is affected and father to son transmission is there. Y chromosome is acrocentric, hence Y-linked disorders will lead to low fertility rate. So in the exam MCQs, they will ask you father to son transmission is seen in X-linked, Y-linked, both, none. Answer is Y-linked. Only in males it is affected. X-linked, Y-linked, Y-linked. And low fertility rate is related to X-linked disorders, Y-linked disorders. Answer is Y-linked disorders. X-linked recessive disorders will affect male individuals transmitting to the daughters and they will act as carriers. Here, the involvement of structural proteins will be less common. Examples are hemophilia A, B, color blindness, chronic granulomatous conditions, G6PD deficiency, Duchenne's muscular dystrophy, Fragile X syndrome, Wiskott-Aldrich syndrome, A gamma globulinemia. Remember X-linked Fragile X syndrome, X-linked recessive Fragile X syndrome. X-linked dominant disorders. These are most common sex-linked inheritance, and X-linked gene encodes for enzymatic genes. Males are more commonly affected, and females will act as carriers as they are heterozygous in condition. Females are going to be affected only in two situations. One is homozygous condition, and the other is when one of the normal X chromosomes gets inactive. Examples are vitamin D resistant rickets, Alport syndrome, incontinentia pigmenti. Coming to non-Mendelian inheritance disorders, these include trinucleotide repeats, mitochondrial inheritance, genomic imprinting, and gonadal mosaicism. Trinucleotide repeat mutations can be autosomal dominant or autosomal recessive or X-linked dominant or X-linked recessive. Examples for the trinucleotide repeat disorders will be Fragile X syndrome, Friedreich's ataxia, Huntington's disease, myotonic dystrophy, spinobulbar muscular atrophy, sinocerebellar ataxia. There will be repeats of the trinucleotides CAG or CGG or GAA or CAG or CTG or CAG. Coming to mitochondrial inheritance, the human mitochondrial DNA will contain 37 genes, out of which 22 are transcribed to tRNA and 2 are transcribed to rRNA. So the remaining 13 genes encode for the respiratory chain enzymes since mitochondrial DNA participates in oxidative phosphorylation. The characteristics of mitochondrial inheritance is the mitochondrial DNA has a unique feature of maternal inheritance. M for mitochondrial inheritance, M for maternal inheritance. This is because only ova will contain abundant mitochondria in their cytoplasm. The mutations in mitochondrial DNA showed its effect on central nervous system, skeletal muscle, cardiac muscle, liver, and kidneys. Clinical significance of mitochondrial inheritance. The individual who carries both normal mitochondrial DNA and mutant mitochondrial DNA is called as heteroplasmy. During the cell division, the mitochondrial DNAs are distributed to daughter cells, resulting in variable mitochondrial DNAs in daughter cells. The mutant mitochondrial gene mainly affects the neuromuscular system, that is Leber's hereditary optic neuropathy, LHON. So remember, mitochondrial inheritance, maternal inheritance, there will be CNS involvement or muscular involvement mostly. Coming to genomic imprinting, it is an epigenetic process where the genes are expressed differently based on whether they are inherited from a mother or a father. The imprinted genes are marked in the eggs or sperms to be transcriptionally active or inactive. This results in only monoallelic expression, where only the paternal or maternal allele is expressed. The IGF2 gene is an example that is normally expressed from a paternal allele, leading to normal growth, but a mutant maternal allele will cause dwarfism. So in the exam, they may ask you dwarfism is related to genomic imprinting. What is the gene involved? IGF2. Imprinting involves DNA methylation of differentially methylated regions near genes to regulate their expression. Genomic imprinting has two syndromes. One is Prader-Willi syndrome and Angelman syndrome. Prader-Willi syndrome is seen in 1 in 15,000 persons, and the mechanism is deletion of 15q at q11 in most of the cases. And there may be chromosomal translocation involving the proximal 15q in 5% of the cases. There will be characteristic features. Here there is paternally derived deletion of 15q, P for paternal. Okay, remember like that. Almond shaped eyes, upslanting palpebral fissures, hypoplastic labia minora and clitoris are the characteristic features of a Prader-Willi syndrome persons. And in Angelman syndrome, it is also called as happy puppet syndrome, as the abnormal puppet-like gait, characteristic faces, paroxysmal laughters due to brainstem defect is not apparently associated with happiness. So mechanism is here there will be deletion of 15q11 of maternal origin. Always there will be open mouth expression, widely spared teeth, and a pronounced mandible in these Angelman syndrome persons. And the last one among them, non-Mendelian inheritance, germline mosaicism. The diploid germ cell precursors in the gonads will be heterogeneous. Some will have a mutation and some will not. A mosaic germline mutation is significant because it can be passed to a offspring. Germline mosaicism can be observed with any inheritance pattern, but is most commonly seen with autosomal dominant and X-linked disorders. Most individuals are unaware they oppose a germline mutation until they have the children that are being affected. Clinical information on these diseases which come under germline mosaicism are osteogenesis imperfecta and ovarian dysgenesis. So, genetic diseases, single gene disorders, multifactorial inheritance, and chromosomal disorders. Now we will discuss chromosomal disorders, which are further classified into disorders of chromosomal structure and disorders of chromosomal numbers. Multifactorial inheritance. Some normal phenotypic characteristics have also multifactorial inheritance. The name itself is saying there are multiple factors. Example, color of hair, eye, skin, height, and intelligence. Multifactorial disorders are those disorders which result from a combined effect of genetic composition and also environmental influences. Examples of these disorders are cleft lip, cleft palate, pyloric stenosis, diabetes mellitus, hypertension, congenital heart disease, coronary heart disease. As per the CBME, curriculum-based medical education guided by NMC, only cytogenetic abnormalities and mutations in childhood will come under the genetic disorders which must be known by each medical graduate. Disorders of chromosomal structure will result in deletion, inversion, translocation, ring chromosomes, and isochromosomes. The technique that is used to detect these chromosomal structure disorders is fluorescent in situ hybridization or FISH. It can detect changes as small as kilobases. Deletion means there may be a loss of portion of a chromosome, both interstitial and rarely terminal. So, based on the types of deletion, interstitial and terminal. Interstitial occurs when there are two breaks within a chromosome, followed by loss of the chromosomal material between the breaks and fusion of the broken ends. Example 46XY, deletion 16, and so on. Terminal results from a single break in a chromosome arm, producing a fragment with no centromere, which is then lost at the next cell division, and a chromosome bearing a deletion. Ends of the chromosomes are protected by acquiring telomerase sequences. So, deletion is loss of portion of a chromosome. It can be interstitial or terminal. Terminal means single break, interstitial means two breaks. And the technique used to detect these changes will be fluorescent in situ hybridization. Coming to inversions. Two breaks within a single chromosome with reincorporation of the inverted intervening segment involving one arm is called as paracentric. Breaks are on the opposites of the sides of the centromere, then it is called as pericentric. So, inversion can be paracentric involving one arm or opposite arms, then pericentric. Translocation. Segmentation of the chromosome, and the segment of one chromosome will be transferred to another. Types of translocations can be balanced reciprocal translocations and central fusion translocations or Robertsonian translocations. In the balanced reciprocal translocations, there will be single breaks in each of the two chromosomes with exchange of material. Translocation between Q of chromosome 2 and P of chromosome 5 is a classical example which will lead to spontaneous abortion or birth of a malformed child. Coming to Robertson translocation, it is translocation between two acrocentric chromosomes and it will occur 1 in 1000 occurrences. Leads to one very large chromosome and a one extremely small chromosome. Significance lies in the production of abnormal progeny, and a classical example will be Down syndrome. So, translocation can be balanced reciprocal or Robertsonian translocation. Coming to ring chromosome, break occurs at both ends of the chromosomes with fusion of the damaged ends, and it results in serious consequences. You can appreciate the ring chromosome in the picture. Isochromosome. When one arm of a chromosome is lost and the remaining is duplicated, resulting in a chromosome consisting of two short arms only or two long arms, is called as isochromosome. Isochromosomes have morphologically identical information in both the arms, most commonly seen in live births. Example, IQ10 involves long arm of the chromosome. XQ isochromosome associated with monosomy for genes on the short arm of the X, and XQ isochrome associated trisomy for genes on the long arm of the X. You can see isochromosomes in the picture shown. Now coming to chromosomal disorders of chromosomal number. They can be euploidy or aneuploidy or mosaicism. Euploidy will be there will be multiples of 23. Aneuploid errors occurs in meiosis or mitosis, and so there will not be an exact multiples of 23. There may be aneuploidy due to non-disjunction and anaphase lag. In non-disjunction, either n plus 1 or n minus 1, their fertilization will produce trisomies or monosomies. In anaphase lag, one homologous chromosome in meiosis or one chromatid in mitosis lags behind and left out of the nucleus, resulting in one normal cell and other cell with monosomy. Mosaicism, mitotic errors during the cleavage of the fertilized ovum or in somatic cells in early development will give rise to two or more populations of cells with different chromosomal complements in the same individual. In division, one daughter cell will give either three sex chromosomes or only one sex chromosome. Example, mosaic variant of Turner syndrome. Autosomal mosaicism. Non-viable mosaic error in early mitotic division affecting the autosomes. Example, variable expressions of Down syndrome. Coming to cytogenetic disorders involving the autosomes. Down syndrome. It is trisomy 21 and it is seen in 1 in 700 live births and the major cause of mental retardation. Maternal age has a strong influence. As the age increases, Down syndrome will also increase. There will be hypotonia with mouth open, protruding tongue, mild microcephaly, single palmar deflection resulting in simian grace. There may be brushfield spots, small overloading of upper helix, and loose folds in posterior neck. And there may be wide gap between first and second toes, rocker bottom feet. And there will be endocardial Cushion defects. Down syndrome can be diagnosed using the help of karyotyping and fluorescent in situ hybridization. Remember, Down syndrome, trisomy 21, major cause of mental retardation. There will be simian keys, wide gap between first and second toes, mental retardation, rocker bottom feet, brush field spots. Edward syndrome, this is trisomy 18 and it is seen in 1 in 6,000 newborn babies, 47XY, and it is the second most common autosomal trisomy. Karyotyping and FISH will help in diagnosis of trisomy 18 syndrome or Edward syndrome. Characteristic features will be small ears, small mouth, retrognathia, clenched hand, overlapping of the fingers, hypoplasia nails, short big toes, and rocker bottom feet. There may be cryptorchidism, ventral septal defects, and hirsutism in few cases, and umbilical hernia and omphalocele. Patau syndrome. This is trisomy 13. Edward syndrome E for 18. Patau T for 13. 1 in every 5,000 births will show Patau syndrome 47XY plus 13. There will be mental retardation, microcephaly, microphthalmia, cleft lip, cleft palate, capillary hemangiomas, polydactyly, cryptorchidism, bicornuate uterus, ventricular septal defect, patent ductus arteriosus. Here also karyotyping and fluorescent in situ hybridization will help in that diagnosing the disease. Cytogenetic disorders involving sex chromosomes. So Patau syndrome, Edward syndrome, and Down syndrome will come under autosomal cytogenetic abnormalities. Sex chromosomal cytogenetic abnormalities will be Turner syndrome, 45X syndrome or XO. There will be complete or partial monosomia of X chromosomes characterized by hypogonadism in a, remember, phenotypic female. Turner, hypogonadic in phenotypic female, 45XO, and it is 1 in 2000 live born females. Karyotyping will help in identifying the Turner syndrome. There will be epicanthic folds, down slanting palpebral fissures, flat nasal bridge, receding chin, low set ears, excessive nuchal skin folds, and webbed neck. So remember Turner syndrome 45XO, epicanthic folds, low set ears, nuchal skin folds, webbed neck are some important features. Next, cytogenetic abnormality involving the sex chromosomes will be Klinefelter syndrome. It is male hypogonadism. Two or more X chromosomes and one or more Y chromosomes will be there. It is the most common cause of hypogonadism and infertility. So in the exam, if they ask most common cause of hypogonadism and infertility and they give the syndromes, out of all the syndromes, you have to mark Klinefelter syndrome. Classical pattern will be 47XSY in most of the cases. There will be low IQ, delayed speech, poor memory, behavioral problems, and problems with psychosocial adjustment, long limbs, low upper to lower segment ratio. There will be tall and slim stature, hypogenitalism, elbow dysplasia, increased FSH and estradiols, decreased testosterone, and gynecomastia. Klinefelter syndrome, male hypogonadism. Coming to mutations. Mutation is permanent change in the DNA of the cell. Mutations affecting germ cells are transmitted to next progeny, while the mutations affecting somatic cells will give rise to cancers and congenital malformations. Point mutations are results of substitution of a single nucleotide base by a different base, replacement of amino acid by another. Examples in sickle cell anemia, there are point mutations. Stop codon or nonsense mutations refers to type of point mutations in which the protein chain is prematurely terminated or truncated. Coming to frame shift mutations, it occurs when there is insertion or deletion of one or two base pairs in the DNA sequence. Classical example will be cystic fibrosis of the pancreas. Trinucleotide repeat mutations will be characterized by amplification of a sequence of three nucleotides. Techniques for molecular analysis of genomic alterations can be asked for 3 marks questions. It is fluorescence in situ hybridization FISH, multiplex ligation dependent probe amplification, southern blotting, cytogenomic array technology, array based comparative genomic hybridizations. Fluorescent in situ hybridization can be asked for 6 marks question or a 3 marks question. What is FISH? FISH is fluorescent in situ hybridization. Here it uses DNA probes that will recognize sequences specific to a particular chromosomal region. The extension of FISH is called as chromosomal painting, and the fluorescent dyes will emit different wavelengths. Using this, we will be performing the test. FISH can be performed on prenatal samples, peripheral blood cells, touch preparations from cancer biopsies. And FISH will be useful to detect aneuploidy, microdeletions, complex translocations, and gene amplifications in breast cancers and neuroblastomas. Multicolor FISH or spectral karyotyping includes 5 fluorochromes, and they permit visualization of entire human genome. And so it is called as spectacular karyotyping. Thank you for patiently listening. Please like, share, and subscribe Dr. Ravichandra Official for more videos.